Diabetes is a disease in which the body cannot efficiently use the food that we're eating. We can't turn the food we're eating into glucose properly and use the glucose properly. And that's either because our body's not producing enough insulin, which would be type 2 diabetes, and we're not able to use the insulin we're producing properly. So we're not able to get the glucose into our cells and use it for energy. With type 1 diabetes, our body basically turned against itself and the immune system attacks the cells that make insulin, so then we no longer produce insulin. Then we have to inject insulin. With diabetes, we want to control the carbohydrates in our diet, and when we eat food, our glucose level goes up in our blood, and then our pancreas will pump out insulin. If we're controlling the amount of carbohydrates that we eat, we can normalize our blood glucose level. And we suggest using a consistent carbohydrate intake. So what that simply means is trying to have regular meal times and eating the same amount of carbohydrate at those meals each day. Nutrition is very important to anybody in general, but with diabetes especially important. Exercise helps with diabetes because our body is better able to use the insulin that we're producing and also the insulin that we're injecting in type 1 diabetes. And with type 2, our body experiences insulin resistance. We're not able to get the sugar into our cells and use it for energy efficiently. Insulin resistance basically is when the cells are being stubborn. They're not opening up and letting the sugar come into the cell. So in the muscle cells, we want to open up the cell doors and let the glucose in. So exercise can help open up the cell doors in the muscles, and when we exercise, we strengthen the muscle, and the muscle will require more glucose. It is possible for a diabetic to live a full life with proper nutrition and exercise, sure, and you can get the best glycemic control possible by controlling your carbohydrates and exercising daily. The Diabetes Association recommends about 30 minutes of activity every day. Monitoring your blood glucose is important with exercise because you want to prevent hypoglycemia, which is a low blood glucose reaction. You may feel sweaty, shaky, even irritable, grumpy, very, very hungry. If you experience these symptoms during exercise, you want to stop and treat it as soon as possible. And that can be treated with 15 grams of quick-acting carbohydrate, which would be a half a cup of juice, a cup of fat-free milk. It could be 8 ounces of Gatorade, a half of banana. Those type of things will work to treat a low blood sugar. And before we exercise, we want to take our meters and test the blood glucose before we exercise. If we're close to low blood glucose, around 70 or less would be a low blood glucose, then we definitely want to treat it before we begin to exercise. If you're going on a long hike or you're going cycling for a long period of time and you're getting more exercise than you usually do, it's important to pack a snack and take it with you. Good resources to learn more about diabetes would be diabetes.org, would be the American Diabetes Association website. A lot of excellent information. There's another good website called DLife, and there's also a show on every Sunday night called Diabetes Life. And other websites would be the Glucerna website, diabetescontrolforlife.com. They're all excellent resources.